I'm Nigel Edwards. I'm Director of Global Healthcare Reform with KPMG. I'm also Senior Fellow at the King's Fund, which is a policy institute in London. I'm visiting professor at the London School of Hygiene and Tropical Medicine. It's great to be in South Africa. It's my first time here. It's good to have been invited. But my thesis really is some rather bad news for hospitals and hospital groups. Across the world, we're seeing that they're in big trouble. They're operating clinical and business models which really are not fit for purpose in the future. They're often not specialised enough. They're not really able to deal with patients with multi-morbidity and chronic disease. They're under siege from increasingly aggressive and activist payers, pay-for-performance schemes, diagnostic-related groups, and a variety of other measures which are making life rather uncomfortable. And they've really premised their whole model on growing. And of course, in a lot of economies, that's just not an option. And even here in South Africa, with your high rates of economic growth, this is an issue. Can you continue to grow your revenue? Almost certainly not. You've got to rethink the model. So the question is, what do you do? And there seem to be sort of four strategies. The first two are really a kind of version of business as usual. You know, can I grow my model into someone else's market? So have a look around the world. Who's got a high margin market that we can put a new model into? Can I merge, take over, perhaps move into other bits of geography in the place I'm in? This requires you to have a replicable business model and a management system that you can pick up and move about. And some people have got the capability to do that. So we see people like Ramsay Healthcare moving into France. They've been in the UK. They've been looking at a number of other countries where they see opportunities, and they can pick this model up and move it. Merge is a bit more risky. A lot of them fail. You really need to do your due diligence, and you can find yourself taking over things which actually, in retrospect, were not such a good idea, and we see quite a few examples of that around the world. But this is basically just trying to grow the current model. There are perhaps other ways of doing this. You can make it more efficient. Still quite a lot of opportunities to reduce length of stay and improve day cases. But basically, you're still working the same models. So we need to start to think about what different models might look like. So vertical integration, taking over primary care, buying medical groups in the US and starting to get the doctors more closely aligned with the organisation. Looks pretty important as a strategy. We see that in quite a lot of places in the world. Building networks. There's some quite well-established networks here in South Africa. We're seeing that in other countries in the world. Again, it allows you to take a model that works and spread it around the system. We might see hospitals increasingly as like shopping malls where they have lots of different operators coming and bringing in services. It's a kind of advanced version of outsourcing. Management contracts, taking over public hospitals and running them is a early sign. We see this in Spain, a bit of it in the UK. There's, I think, an example here in South Africa. Perhaps one of the two exciting models here are academic health science centres, which is building links with universities and research organisations, leveraging big pharmaceutical money, building networks, getting big clinical trial databases running. Not open to everyone as a strategy. The other is using quality as a defining bit of your strategy. So we see places like Yon Shopping in Sweden, Intermountain Healthcare in the USA, who are using quality as the thing that sets them apart from everyone else. Being more radical still, we see focus factories just doing cataracts or just doing heart surgery and getting really, really good at that and engineering that. Disintermediating the insurer, disintermediating primary care, taking links out of the supply chain, going straight to the consumer with a low-cost offer. Looks like an interesting strategy. But the really important thing to think about, I think, is the breakthrough disruption. How do you stop going the same way as the steel mills? And this is kind of my message in the USA. This is my message, I think. We need to start to think about what's the equivalent of the low-cost budget airline for healthcare. How do you provide really good quality healthcare in a different way using a different system? Because if you don't think about it, you can be very sure that around the world there are lots of other people doing the same.